We're going to start with Dr. Justin Horner, and I will briefly introduce you, Dr. Horner. He was born and raised in Bismarck, Mandan, North Dakota, and received his medical degree from the University of North Dakota in Grand Forks, and then his master's in public health from the University of Minnesota. His residency and fellowship were completed at Mayo. He is currently in a healthcare MBA program at St. Thomas University in Minneapolis. Dr. Horner is chair of all pediatric subspecialties at Sanford and Fargo and enjoys all kinds of outdoor activities. Thank you so much, Dr. Horner, for joining us today.
Today, for my talk, it's going to be really just kind of sit back and relax and meet the cardiologists of the state, as well as a little bit of the history. To get started, we'll talk a little bit about North Dakota. Obviously, we all know where we're at, and for Dr. Cannon over there in Rochester, this is North Dakota, just so you know. We have had a long history of pediatric cardiology here in the state, and a lot of that has originated in the Fargo area. And believe it or not, way back in the day, we had two congenital cardiothoracic surgeons here in Fargo, North Dakota. They also did some adult cardiac surgery, but they did significant work in the congenital realm. And I have a few adult congenital patients in the Bismarck area that still are doing a wonderful and had a one-time surgery for AV canal type repairs by Dr. Brody. Those things are wonderful to see. It was a long time ago, though. The pediatric cardiology group here in Fargo was quite robust as well, with Dr. Gerald Atwood, Guy Carter, Harold Kuhn, and William Norberg. At one time or another, there were 3 to 4 of them here. They all also saw or staffed the ICU, the pediatric ICU, and they also saw some general pediatrics as well. From that time on, though, it moved on to eventually Merit Care here in Fargo from the Fargo Clinic. And we all probably remember the beloved Dr. Rodrigo Rios, who was here for about 12 years or so at Merit Care and then moved down into the cities. He is the third, and his son went into pediatric cardiologist and is now is the fourth, Rodrigo Rios, as a interventionist at the same practice down in Minneapolis. For a short amount of time, I think it was about 3 or 4 years, Mark Zittergrun was a pediatric cardiologist here at Merit Care with Dr. Rios as well. So they were partners for about a 4-year period. And I want to thank, I forgot to mention, Candy Barasa as our nurse. She helps me with the history here of this and still remembers many of these providers. For a short time, or actually a long time, Dr. Moeller, James Moeller from the University of Minnesota, was doing outreach up in the Minot area, and he did that for many, many years until Dr. Treves, our group, one of our group colleagues here, was able to move to North Dakota and take that over. Mayo Clinic, of course, has been doing outreach as well into the state of North Dakota and still does to this day, and I'll talk just a little bit about that. They were doing it probably now it's been decades. They were doing it for about 12 years before I was a fellow there. And so it's been going on and serving our patients as well in the state. Dr. Joel Harden, as well as Dr. Patricio Fernandez, both were in Bismarck at separate times and for relatively shorter stints. They also saw other types of patients as well in terms of NICU or ICU or general pediatrics, but they also had some time in the Bismarck area from pediatric cardiology. So the history's been long, and it's been decades worth of congenital care as well as pediatric cardiology care in the state of North Dakota. And we appreciate all of these sort of forefathers of taking it to where it is now. And if we can discuss today's state, we have Sanford Children's with cardiology, we have Essentia Health with cardiology, and we continue with outreach services from the Mayo Clinic as well as Children's of Minnesota. And just to highlight those two groups quickly before we move on to the in-state groups, Mayo Clinic still does outreach, and that's been, I think with most outreaches, have been altered a bit with COVID, but they routinely have been doing outreach services at CHI, at St. Alexis Health in Bismarck, as well as All True Health in Grand Forks. And again, in both of those cities for decades. Children's of Minnesota is doing outreach here at Essentia Health in Fargo, as well as in All True Health in Grand Forks. And I think, again, maybe altered due to COVID, but still practicing within the area. And we appreciate their help in terms of the volume. So if we start off with Sanford Children's, I'm going to talk a little bit about our group, and then Dr. Christina Rauser-Foltz is going to be able to talk about the Accenture group very shortly afterwards. And then we'll be able to move on with the day, and I believe Dr. Ken is up next. So at Sanford Children's here in Fargo, we offer quite a few things from a standpoint of services for your patients. From a standpoint of pediatric or congenital cardiology, we have obviously outpatient clinics, and we are available to do consults. We have adult congenital cardiology work here. We all see adult congenitals, but you'll see Dr. Trebs is our board certified adult congenitалist, and we try to refer the majority of the adults to him. Fetal cardiology is available as well, and then we do inpatient and call services 24/7, 365 days a year. Our pediatric echo lab is IAC accredited, and we have 10 pediatric and fetal board certified techs. We do transthoracic, transesophageal, and fetal echocardiogram here within Sanford Children's. We're able to do ECGs, event Holter monitors, exercise, cardiopulmonary stress tests all here. Just of note, we get it occasionally from primary care. Can you do a tilt table? We do not do tilt table testing here. We have a lipid clinic, which you'll hear about later today. We also have a pediatric anticoagulation program that's been very successful. So just like the adult warfarin clinics or adult anticoagulation clinics that are typically run by nurses, ours is ran by our nurse and protocolized and approved, and it's been has been very helpful to our patients and has been able to get them to have less swings, if you will, in their anticoagulation. We'll talk a little bit about our outreach services that we provide. And then we also have Dr. Cannon on with us, thankfully, and he is able to do some outreach for us as well, right here in Sanford Children's in Fargo, and does a clinic for our electrophysiology patients, as well as in the Bismarck area for us. Our major referral centers in alphabetical order are Children's of Minnesota, Mayo Clinic, and University of Minnesota, from a standpoint of the majority of our patients going there for intervention or EP. And then I've added some numbers there for scheduling to see us in our outreach sites. So that kind of brings us to outreach. Of course, we're centered here in Fargo with the 5 cardiologists, and I'll introduce our team here in just a bit. We started doing some outreach before I joined in 2012. Dr. Trebs was doing outreach in Bemidji and Minot, and those continue today. We have outreach services now in Bismarck. We added Thief River shortly after Bismarck was added, and now we're out into the Dickinson area as well. And so as you can see, we have the majority of this region covered. We were in Alexandria for a short amount of time, but the volume was less, and we had to kind of cut back on that one. So what do we do in outreach services? What can we offer to your patients? We, of course, consultation, ECGs, event and Holter monitors, echocardiogram. We do fetal echocardiogram and outreach. We do exercise testing in Bismarck for outreach sites. We also do it here in Fargo, of course. And then we have electrophysiology outreach clinics from Dr. Cannon in the Mayo Clinic in Fargo, as well as in Bismarck. So what has that all led to? It has led to a significant amount of patients, and our growth has been significant. I joined in 2012, and I was the second pediatric cardiologist to join here at Sanford Health. And as you can see, the time we've added more and more providers, and our numbers of patients seen per year have gone up. And the same for echocardiograms and the rest of the services that we offer. This is Fargo, or this is just tremendous growth, and it's a needed necessity. The patients and their families appreciate it, and we're happy to be able to offer those services. So what does our team look like in terms of pediatric, congenital, and fetal cardiology? We'll start with Dr. Trebs, who is originally from Webster, South Dakota. He did medical school at the University of South Dakota, and then went on to his pediatric residency and fellowship at the University of Minnesota. He's been practicing here at Sanford Health since 2009, and his outreach services are listed. He's also adult congenital board certified for our group. And then I joined in 2012. I'm originally born in Bismarck, North Dakota, and did medical school at the University of North Dakota, and then did residency and fellowship at Mayo Clinic. As I said, joined in 2012 here at Sanford Health, and outreach services for myself are in Bismarck and Dickinson. Dr. Miranda is originally from Monterey, California, where he was born, and I asked him the other day where he was born, because I couldn't remember off of his CV, and he said, my question was actually, where's your hometown? And without a second's delay, he said Fargo, North Dakota. And so I very much appreciate his willingness to take this as his home, but he's been all over the place, and the medical school in Dominican Republic, did pediatric residency at Cook County in Chicago, and then moved across the street, if you will, into Rush University for his fellowship. He joined our group here in 2016. He does outreach services throughout the region, as you can see there, Bismarck, Minot, and Thief River, and it's been a pleasure to have him in our group as well. Dr. Brasher came from Bloomfield, New Jersey, and her medical school was at Rutgers. She did her residency at Rutgers, and then she also did a chief year there as well, showing all of us up. And her fellowship ended up being at Seattle Children's, a wonderful institution. And as you can see, we're starting to spread our group out across the whole nation from coast to coast. It's wonderful to have her here, and she's joined us in 2018 and does outreach services in Minot, Dickinson, and Bemidji. And then finally, Dr. Thompson joined our group. He's originally from Grand Forks, North Dakota, did his medical school at University of North Dakota, and then followed in my footsteps and went to the Mayo Clinic for residency and fellowship. He is practicing here since 2019 and does outreach in Bismarck and Bemidji. We have a nurse practitioner with our group too, Sonia Dahl. She's originally from Felton, Minnesota. She did her nursing school in Winona and her doctorate of nursing at the University of Minnesota. She was a nurse for a long time at the Mayo Clinic in the ICUs, and then began practicing as a nurse practitioner at Mayo Clinic with their heart transplant program for approximately 6 years, and then joined us in 2019. I'll touch a little bit about Dr. Cannon. Even though he's from the Mayo Clinic, we include him in part of our team. He's a wonderful asset to have, and if as a pediatric cardiologist, if you don't have an EP in your back pocket, you're probably going to be in trouble. And he and Dr. Wackel are wonderful colleagues for us to have, and save us many times over with their patients and EP problems. So Dr. Cannon's originally from Lubbock, Texas. He did his medical school in Dallas. Did his residency at Texas Children's. He also did a chief year, and then pediatric cardiology fellowship in Texas as well, and pretty much didn't leave the state of Texas until he decided he was going to come to the Mayo Clinic in 2010. He ended up practicing at Texas Children's for 7 years, then brought his expertise to Mayo Clinic, and has changed EP at Mayo Clinic as well as our region forever, and we very much appreciate his services. Again, he does outreach EP service clinic right here in Fargo, North Dakota, as well as in Bismarck. Both of those are through Sanford sites, and then Grand Forks, North Dakota, through the Mayo Clinic outreach site as well. So I'm going to just take about 2 minutes to talk about a murmur, just because I couldn't just give you guys an introduction and murmur. So I just want to give you one slide on it. A murmur. This kid is 2 years old. He's running around the room. He's healthy. He's happy, and he has a murmur, and his growth curve is great. So what do we routinely see from primary care? Possibly an ECG at $50 a cost, roughly, if you look that up on the internet. Possibly a chest x-ray as well, $150 on top of your visit. And then maybe I'm going to order an echocardiogram. And that's roughly about $2,000. And all of this is, of course, pre or before insurance cost. But I could say, well, I'm still not certain about it. I don't listen to murmurs every day. Maybe I should refer them to pediatric cardiology, which is the best method, which is the best approach. And we will advocate, obviously, for the consult, and I'll let you know why. 2014, there was appropriate use criteria that was put out by many authors, including some from the Mayo Clinic. And as you can see, pretty much every cardiology institution and or society is on this statement. And they said, what is the best approach for murmurs? And if you have a murmur that is an asymptomatic kiddo doing well, the criteria there on the far left of my screen, so probably, yeah, left of your screen, will be a red box, meaning do not order an echocardiogram. And that little parentheses that's down there is a 1, and the 1 means that you do not have enough criteria to order it. You need a 7 to 9 to order that, and that's a pathological murmur. And sometimes we have a hard time determining, is it innocent, is it pathologic, and or do they have a family history of something, or do they have their own personal history of something? So you kind of thinking, do I need an echo? Do I not? What should I do with this kiddo? They're doing great. Well, what's the cost of that? A paper in Journal of Pediatrics came out in 2002 and said, well, what do we do about evaluation of heart murmurs? what's the cost effectiveness, what's the practical implications. And the conclusions really were adding a chest x-ray and an ECG to a pediatrician's evaluation was adding nothing to the accuracy of any of those evaluations, and really just drove up the cost. And in the end, they said, well, the best way to do anything would be to get an echo on every murmur, but at a cost of about $158,000 per additional case detected over referring that to a pediatric cardiologist. So you have an innocent, or you have a murmur, quotations, of a kiddo who's doing quite well out of the newborn period. My recommendation would be refer to us, and we're always happy to see them. And if you have real concerns about that murmur, and you're like, you know, I just called and their wait is 6 to 8 weeks, just call us, give us a ring. We're happy to chat with you. We can get people in at any time that you want us to. A quick little note about our hospital here, of course, opened up about almost 3 years ago now. The Fargo Sanford Children's Hospital is there up on the 9th floor. The whole floor is dedicated to our services, and we have 32 inpatient beds that are either general or PICU. Each room can be an ICU or a general bed. They were built exactly the same, and at times we've had 20 people in our ICU and less than the general, or the other way around. And we got 40 NICU beds, and we have 24/7 in-house hospitalists, and we're a level 2 designated trauma for pediatrics, level 1 trauma for adults. Our inpatient outpatient services are quite extensive, and you all can review this at your own time, but this is all of those listed there are pediatrics, fellowship trained providers, and none of those are adult services that are added on just because they might have some interest in pediatrics. So I don't want to leave out Dr. Majed. She has joined us in the last year. She's an outstanding pediatric nephrologist, and she's going to give us a chat today, and so I thought I'd give you a little introduction on her. Originally from Beirut, Lebanon, did her medical school in Beirut, did her residency in New Jersey, and she did her fellowship at Columbia University, a very large and reputable institution in New York City. She was practicing at Geisinger Medical Center, which is a large institution, has pediatric residencies and fellowships, and did quite well there for a couple of years. And now we thankfully were able to bring her to Fargo, North Dakota, and she's been here since 2020. She has not started outreach services, but from a Sanford Health standpoint of pediatric nephrology and hypertension, please refer all general hypertensions to our nephrologists. Those patients can be seen in Bismarck as well by Dr. John Sanders. So last but not least, I'm going to turn it over to Dr. Christina Rauser-Faltz, originally from Bismarck, North Dakota, did her medical school at the University of North Dakota, and did her residency at Nebraska as well as her fellowship. She's been at Essentia across the street here in Fargo since 2019, and we have the privilege to have her join us here in Fargo as well as see our patients in the state of North Dakota as well. I'll turn it over to her to chat a little bit about Essentia Health.
Thank you, Dr. Horner, for that very kind introduction. I want to thank the organizers today for including me for this very nice conference that you put together. And I'm just going to spend a few minutes talking to you about pediatric cardiology at Essentia Health. So our mission at Essentia Health states that we're called to make a healthy difference in people's lives, and we strive to fulfill this mission statement and honor our values, and that's reflected in the care that patients receive at Essentia Health. So I'm going to reiterate a little bit of the history that Dr. Horner has already spoke to you about. Dr. Rodriguez has been providing outreach services from the Children's Heart Clinic for about 12 years. So when he left practice here in Fargo, he had a large patient population that he's continued to serve. And he continues to see patients at Essentia Health about 1 to 2 times a month. I joined the team in September of 2019, and I've spent this last year's been dedicated to building a full-time pediatric cardiology department. So I serve as the primary cardiologist for both inpatient and outpatient services. We provide pediatric cardiology consultation and diagnostic services, including echocardiography, electrocardiography, Holter cardiac event monitoring, stress tests, and fetal echocardiography. So our newest program is our fetal echo program. We provide consultation as well as echocardiography. It's really nice that we're able to provide a continuity of care starting from the prenatal period. So we're thrilled to be able to offer this to our patients. And I'm delighted to report that we have a full-time maternal fetal medicine physician joining us at Center Health this fall. And we can't wait for Dr. White to join our team. So we often use child life specialists in our cardiology clinic, and this typically comes into play when we have an anxious child or maybe an uncooperative toddler who we have to perform an echocardiogram on. And our child life specialists do an excellent job distracting our patients so we can get appropriate imaging. And of course, these services come at no cost to our families. So we're really fortunate to provide continuity of care from the prenatal period. My nurse is really great at coordinating care, transitioning from the inpatient world to discharge. And we recognize that many of our patients come from outside the Fargo metro area, and our nurse is really great at communicating with families to try to ease this burden for them. We also recognize that families can be quite anxious when they learn that their child needs to see a pediatric cardiologist. And for this reason, we try to see most of our referrals within 2 to 4 days. I'm also afforded the opportunity to provide extended attention and care for each patient and their families, and this is very well received. So our commitment is to addressing patient and family barriers to health, connecting with families in a meaningful way, providing resources and a support system in our patients' lives, and spreading joy and compassion in our community for quality care. Thank you.
Thank you so much for presenting kind of the broad overview of options that we have to access pediatric cardiologists in the state. I do have one question. This is a me question, not from the chat box. So I'm just curious, what percentage would you say of patients that are being referred to you before echo or evaluation for benign murmurs do you guys not perform echoes on?
We have, we just started running that data actually, and we did in 2018 through the whole year of 2020, we did 4,000, or sorry, 2,000, a little over 2,000 echocardiograms for murmur. And that was not just our group, that's all referral echocardiograms. And we're about 400 of the way through that to start to evaluate who is getting a murmur for an innocent murmur and what is that finding. So we don't know that real data for you yet, but we do know that about 75% of the patients that come to our clinic do get an echocardiogram. I know that data for sure, but what I'm looking at and what we're really trying to find out is, and this is really just some of my own MBA schooling and stuff, is like, well, what's that, that murmur that's sent to us and not ordered by a cardiologist, what is the percent of actually finding something? We do know also that roughly somewhere between 50 and 80% of all children will have a murmur at some time in their lifetime. So with that many people having a murmur and only roughly 1% of people having real congenital heart disease, the chance that you have a murmur is that is pathologic is really quite low, especially if you're running around and healthy. If you have a family history that's strong for something, if you have like bicuspid valve or something like that, or you actually have a history of something in your own personal history, whether it was, exertional syncope or exertional chest pain or something, then maybe a murmur is warranted. But again, still, we're looking at that data, and I'm happy to send it out when we get it done. It's just going to take a while to get through 2,000 echoes.
Well, I think that's great. I mean, keeping this conversation going is really important as we think about how to best coordinate care for our patients and how to most effectively and efficiently utilize the resources that we have available to us. So I think that's a great question, and I'm excited to learn more about the research that you're doing.
The one thing I wanted to point out is that we can't see the chat box, so if you all have questions, please just kind of, yell them out or what have you. We're always happy to chat.
Say, Justin, this is Christina. Quick question for you. When we hear an innocent Stills murmur in clinic and it's nice and vibratory, I have no concerns. Sometimes it's very persistent and I just keep documentation in my note. On average, how long are those Stills murmurs there and when can we expect them to go away?
Typically, most of them are going to resolve sometime between 5 and 8 years of age, but some people will keep them for forever. It just depends. I don't think we have a good handle on exactly where that Stills murmur comes from. There's a lot of theories about this or that and where it comes from, but the most common time you're going to hear it is between 2 and 5. Now, I've heard them down all the way to like 4 to 6 months of age and all the way up to like 8, 9, 10 years of age. But eventually, I think you just get big enough that you don't hear that normal sound anymore.